I think we can go ahead and get started. Thanks so much, everyone, for joining us today for this special webinar ahead of our upcoming theme issue on racism and health. I will be moderating and sharing some information from the health affairs side, and then I'm very pleased to be joined by Dr. Rachel Hardeman, an advisor from our previous theme issue on racism and health, to share some thoughts as well. And then at the end, we will have a Q&A. And so I have some slides, which if we could pull those up, great. Okay, thanks so much. Next slide, please. So our agenda is to talk about the current request for abstracts, to provide some tips on submitting an abstract more generally to health affairs, and to speak with Rachel about our previous issue and writing for health affairs in general, and then followed by the Q&A as mentioned. Next slide. Just a reminder, at Health Affairs, we believe that understanding and addressing the impact of racism is essential to building equity in health systems and healthcare policy. And we definitely take to heart the notion that this is not published about enough, particularly in healthcare and health policy journals such as Health Affairs. Next slide. So some basics on the upcoming issue. This is slated for October of next year, 2023. This is the second issue on this theme. The first issue on racism and health was published in February of this year. As usual, we plan to publish about 20 peer-reviewed articles along with other creative content, as well as forefront articles, and that is our online publication previously known as Health Affairs Blog. The RFA is actually already live. We made the decision to open it up earlier than previously to give people even more time to start working on their abstracts and submit them by the deadline of December 19th, 2022. And then once we do our internal process of looking through all the abstracts submitted and deciding which to invite, invited papers will be due April 14th, 2023, just to give a sense of what the timeline for this issue will be. Next slide. So I'll go over just a handful of bullets of the topics and areas of interest. Please know this is not an exhaustive list. This was taken from our current request for abstracts notification, which is live on the website, and it will be updated based on a planning meeting we had very recently to kind of refine it and include more topics that came up at that meeting. And then also the list is not exhaustive. So we are thinking creatively about the issue, and we want to know what folks are working on and what's most exciting and engaging to publish on. So we're interested in the state of research and innovative research methods to study this complicated question. Underexplored topics, we covered many topics in the previous issue, but certainly we're just scratching the surface. We're interested in how racism can be targeted through interventions and policy. We're interested in hearing from the community. That's a very important focus for us. We want to know about the roles for healthcare and health systems in combating and addressing racism. Other topics of interest are disparate treatment and disparate impact, environmental and occupational health and how that relates to experiences of racism. Next slide. We are interested in the role of the medical and health services research, such as our journal, immigration policy, policing and criminal justice, intersectionality, recognizing that the forms of trauma people experience are compounded and have compounded effects. We're interested in community-centered and community-led efforts to counter racism, and policy and health system reforms also intended to counter racism. So what's out there to address the problem? And a full list of topics will be available at the website listed here, and that's on our request for abstracts page, and will be updated by next Monday, and then should be our most recent list of topics we're interested in. And please, we encourage you to think creatively about the topics and send us abstracts of interest that are not on the list as well. Next slide. So I'm just going to go through some general tips. These are tips that are relevant regardless of the topic of the theme issue, but I find it helpful to kind of break these down, and we do tend to get questions about these more general tips. So in your abstract, just make sure you state concisely what the research question is, why it's important, and what you're going to do in the paper. Make it clear what type of paper it is. Is it new empirical work? And in that case, is it quantitative or qualitative? Is it a review article, a commentary, a narrative matters essay, or something else? You don't have to say it explicitly, but it should be clear what type of submission we're looking at. Next slide. We do favor abstracts with concrete examples and specifics rather than ones that are overly conceptual or theoretical. Process-oriented papers or papers that are focused narrowly on operational issues tend to not do well. And then we always recommend asking someone who is not expert in your topic to read your abstract before you submit it and offer honest feedback. Next slide. A reminder, you don't have to do it alone. Reach out to your colleagues and collaborate on the abstract. Most of our abstract submissions and ultimately papers have multiple authors from multiple institutions. Our abstract deadline is firm. We begin processing the abstracts just hours after the deadline, so we cannot unfortunately accommodate late submissions, and hopefully opening up the RFA a little earlier helps folks get ready for this upcoming deadline. And we only consider submissions that come in through our abstract portal, which is submittable. So please do not submit through Editorial Manager, which is where your typical papers are submitted to Health Affairs. Next slide. Just some tips for quantitative papers include a brief description of the data and methods, important findings, and your discussion conclusions. Please specify what the findings contribute and how they relate to policy. This will ideally include variables that measure effects of some kind. And please be clear about the sources of data, including the years of the data, and basic metrics such as sample size and response rates. We don't have the opportunity to ask follow-up questions in this RFA voting process. So sometimes we'll see abstracts that don't include the years of the data, and then we're left in kind of a tricky position of not quite knowing if it's right for us or not. And speaking of the age of the data, we prefer papers that are where the data is within 5 years of the publication, in this case, October 2023, and or is the newest data available. Next slide. Understandably, sometimes it is a small study, a small sample. It might be one state, one group, or one program. And this doesn't necessarily rule something out, but please provide some context on why it's important, even given that limitation. And then provide basic information on the outcome variables and the analytic methods. And if findings are not yet available, which is common, note what outcomes will be measured and what questions the research will address. Just a note, we appreciate that you might not have results right now, but we just need to be confident that by April of next year, when the paper is due, the results will be in. So if data collection appears from the abstract to not have yet begun, that might give us pause if the collection process does not seem simple. So any assurances you can provide on that front within the 500 words, which is the word limit for abstracts, is helpful. Next slide. We are very interested in qualitative work. Similarly, be clear about what the research question is and why it's important. What type of data will be collected and when, what methods will be used to analyze the data. What's the sample size and why is this number sufficient? We recognize that smaller samples are more common in qualitative work, but it should be clear that this is you've reached saturation or it's a sufficient sample. Be as specific as possible in describing the main themes that are arising from the research and how they contribute to knowledge and policy. So, if we see a more generic theme like leadership is important, those abstracts just tend not to do well. We're wondering, so what are we learning from this beyond what we already know? And then we recognize that qualitative work is not meant to be generalizable, but it should be transferable. So, so anything you can say to that end to explain how the results go beyond the sample that the study is limited to. Next slide. For reviews and commentaries, these are, we know, a different beast, but give a sense of the structure of the argument and the types of evidence that will be considered in making the arguments. These typically come along with recommendations, so do present those. And don't forget to provide a sense of the obstacles and issues that would need to be addressed to advance the recommendations. Be clear about the problem being addressed and why it's important. But also don't spend too much time on context. You want to leave room to develop your argument and takeaway points. And when proposing remedies to problems, please be specific about roles and responsibilities, such as who should do what. Next slide. Narratives, which I edit the narrative matters section of the journal. So these are personal stories about healthcare that highlight policy issues. And I often get questions about, should I submit an abstract for a narrative matters piece? Yes, please submit an abstract for anything you can envision putting into the issue. And so in these, we want to see a general arc of the story and what policy issues will be discussed. So just what happened in terms of the story, what policy issues does the story raise, and why does it matter? Who does it matter to? And then a general sense of what should be done about the problems, not everything under the kitchen sink, but a sense of 1 or 2 recommendations. And it's just helpful if the abstract gives a sense of your literary writing style, your voice, so we can picture sort of what the full essay would look like. Next slide. And just a final note that we are interested in other types of creative content. So the first issue had a bit of this. We had art, poetry, we had a story map that was interactive, to look at disparities in access by race and ethnicity. So we welcome concepts for novel submissions for the next issue as well. We do want to see an abstract so we can start to wrap our minds around it and keep track of it. So provide as much detail as possible to allow us to picture what the final product would be. So in the case of a multimedia or visual proposal, maybe there's a web address that you could write out the full link to where we can view or listen to other work you've done, or just describe in words, sort of, it's tricky because it is other creative content, but describe as well as you can in words what we'd be receiving in the final version. So we can, in that case, probably have some follow-up conversations because it is sort of a different medium. Next slide. And with that overview, I'm very excited to introduce Dr. Rachel Hardeman, Associate Professor and Blue Cross Endowed Professor of Health and Racial Equity at the University of Minnesota. Dr. Hardeman was an advisor on the first Racism and Health theme issue, along with Jose Figueroa. And we'll just have an open discussion about sort of what makes a successful abstract, what advice you have. I'll probably ask some other questions about your experience as advisor. Just a note that we received, I think, more than 360 abstracts for the previous issue. So, so much work went into that. Thank you so much for your work on that and for joining us today. So I will hand it over to you and we'll just have kind of an informal conversation before opening it up to Q&A. And another note before we do that, I do see that there's some questions being submitted to the chat, which is great. And then also feel free after we're done with this portion to raise your hand and unmute. So thanks so much, Rachel.
Yeah, thanks for having me. And thanks everyone for joining. I didn't prepare any sort of formal remarks at all, but just wanted to reflect on my experience and having the opportunity to serve as an advisor for this special issue and having poured through over 300 abstracts. It was certainly an honor to be a part of sort of the development of such an important piece of scholarship. And, for me as someone who has, been doing health equity research for a long time now and really thinking about how to translate empirical research and empirical evidence into action, that was a really compelling part for me of of joining in on this work, and also part of the lens I took as I, spent time reviewing abstracts was really thinking about, the fact that because of the incredible scholarship that's come before us, we have well documented information on what health disparities are, sort of what the health equity landscape looks like. And so I was, thrilled to be able to review abstracts that were then saying, okay, but here's what we do about it, right? So really thinking about those intersections of research and policy, and putting forth sort of what next steps should look like in real and concrete ways that were backed by research and backed by evidence. I think one of the other things that I really thought about as I was reviewing abstracts and contributing to this work was the number of young scholars who were contributing to the research and to the landscape, and I think really incredible ways. And while we didn't say we're going to publish this certain number of, or accept a certain number of abstracts from folks who are more junior in the field, I think definitely it was clear from our review of the abstracts that there was some incredible work coming in from up and coming scholars, and also scholars who are thinking, I think, creatively and innovatively about health equity research and pushing the boundaries in ways that we haven't seen before. A lot of what we were able to focus on in that in last year's issue was around really framing the issue of racism, so really addressing all of the ways that racism can show up in health and well-being and policy. So everything from that individual or interpersonal to institutional and structural. We pulled in a lot of, the scholarship around the historical perspective and ensuring that the work that we're doing and the scholarship that's being put forward is grounded in the history of racism in our country, because without, a strong understanding of that, we can't sort of move forward. I'm happy to sort of answer questions. I was thinking about other comments that I would make, as you all are thinking about your own work and sort of how it fits. And I would just say, generally speaking, don't be afraid to be, creative and innovative in the work you're doing and the work you're putting forward. I think that we're at a point where over the past couple of years, we've grappled with some really hard issues in our field as health services researchers, health policy folks, and people working broadly in, public health and health equity. And we have an opportunity now to really, I think, move forward in a way that looks different. And that requires us to publish research and publish studies and other sort of commentaries and narrative pieces that may be unexpected and may be sort of feel a little bit different than what the status quo is. But I think that's how we get to this next step. That's how we get to the next, move ourselves a little bit further down this pathway towards health equity.
Thank you so much for those comments. That frames it so well. And just a note that is included on the RFA. We do encourage papers that represent cross-disciplinary efforts, so bridging health and non-health sectors. In addition, we are very interested in contributions from junior faculty, as well as authors with lived experience of racism, including non-academic community members. And maybe we'll have some time to talk about that, sort of how do we bring those voices into the issue. Authors from historically Black colleges and universities and Hispanic serving institutions, tribal colleges and universities, and Asian American and Pacific Islander serving institutions. And then again, we welcome submissions with a variety of methods, including qualitative work, case studies, ethnographic studies, and community-based participatory research, as well as participatory action research, which we heard a bit about at the planning meeting. We also encourage authors to cite the work of historically and contemporarily oppressed voices. So those are some additional framing points that I wanted to mention. A question for you, I had for you was, sort of as you think about the last issue, was there work you hope to see in the next issue that wasn't covered in the first, or what excites you about the next issue that you might see that appear in those pages?
Yeah, I like that. I appreciate that question. I think there's not necessarily anything that I felt like I hoped to see that didn't make it into the issue. I think it was a really sort of robust and issue that addressed a lot of different aspects, outcomes, angles to this work. I think that as I think about this next iteration of it, this next issue, I am really hoping to see work that even further digs into the political landscape and really concretely making the links between political power in our country and structural racism or other forms of racism, and helping us to sort of think through what that means for moving forward. So I think about the work in the reproductive health space, and how we are grappling with the overturn of Roe versus Wade and sort of what that means through a structural racism lens, for instance. I think that as we really dig into the work of solution-based research, we have to be willing to sort of tackle and address some of the really stickier parts of this, which is power and who has power, and how do we think about how that shows up, and how does community engage in a way that helps to sort of dismantle that. And so that's a piece that I think I'm excited to see what folks are working on in that space, right, moving forward.
And I'll ask one more and then I'll get to the questions because we do have
Sure.
some. Any tips as someone published in Health Affairs for someone who's not published with us before, things folks should know, or as they're crafting their writing team, any tips for first-time authors to the journal, or just a reflection on your experience publishing with Health Affairs that might be helpful to know?
Yeah, I mean, I think you did a beautiful job just of laying out what's expected for a journal submission, which my first piece of advice is follow that. I think that Jess and the rest of the Health Affairs team has been incredibly thoughtful about how to do this and how to make it more accessible, especially for folks who this may be their first submission, or maybe they're not in academia at all. And I think also, I don't want to put you on the spot, Jess, but I think that, I think that folks at Health Affairs are open to, supporting if there's questions and things that come up. For me, I don't know that there's any sort of specific, like, this is the singular tip that will, make you successful. I think that being clear about what your questions are, what you're tackling, what you've done to answer that question, being as clear and concise as possible. I think one of the things that we're really excited about, and Jess touched on this too, is that, this is a team sport. This is a team effort, right? None of this work can be done by one single person. And also it includes, disciplinary frameworks from all over, right? And so I think that there is some thought that can be put into, if you have an interdisciplinary, multidisciplinary team that's submitting an abstract, thinking about how to make that clear, but also the way that, this is like the crux of, like, the sort of challenge there is making that clear in a way that is concise and sort of offers one voice, but it's clear that sort of that work was done in a way that brings in so many important lenses. And yeah, I think that's the main thing I would say.
Yeah, and that reminds me, we added a text field to the RFA with this first issue to allow people to provide additional information, sort of speaking to anything they'd like us to know about their submission in terms of their own lived experience, citing the work of others, and also that would be a place I think folks could talk about the different lenses that go into the abstract that we're viewing.
Can I add one more thing to that? Because you said, I think the underscoring your own lived experience and the lens that you bring to this work is really important. And it's not something that you typically get the opportunity to do in a submission, an abstract submission for a peer review. And so I think, at least for me as a reviewer of abstracts, having that information, I found it to be really helpful. I think particularly as we think about sort of the burgeoning interest in this field and sort of who's contributing, and wanting to make sure that we do this work in a way that is centering the voices of people from racialized communities, centering the voices of people who are closest to the pain and the issues that are that we're grappling with. And so I think that sometimes there's a hesitation to identify one's positionality in this way. And I would encourage you to move away from that sort of tendency and really to think carefully and critically about that. Or even if it's something like, I am the senior author here, and my student who may, be an undergrad or a grad student who is leading this work, because they have this lived experience and they've been able to contribute in these ways, they may not have sort of all of the other sort of academic things that we would be, assuming or looking for in this way. But being able to clarify and sort of lift up what needs to be lifted up in that submission, I think, is incredibly important.
Thank you.
Yeah.
So looking at the questions, we had a question, do you accept scoping reviews or systematic reviews? And if so, do abstracts need to have the results of the review listed? Yes, we do accept those. I think the abstract should contain, the same information, if available, that you would see in the abstract of a systematic review or scoping review, that was published. To the extent that you have information available or preliminary information available, please do include that. It's, I think just knowing that a systematic review or scoping review is going to be conducted often does not give us enough information to know whether this is something we want to invite or not. It's possible. But I think, if the review hasn't begun at all and you're not sure what you found, then it is what it is. But to the extent you can sort of start providing some of the early findings or themes, I think that would be helpful. And Rachel, if you have any thoughts to jump in, please do. There are going to be questions I don't know the answer to.
Yeah.
And then we have, oh yes, I mentioned there would be forefront articles. How many will there be? There's no set number. And the timeline, I think, is flexible in terms of actually, we'd like to be publishing these in the lead up to the issue. So, if you submit something to Forefront now that's interesting, we'll work on getting it published now. But in terms of it being tied to this issue, certainly in the months ahead, leading up to the issue, we hope to publish content. So if you have content now, submit it. If you're working on it for early next year or mid next year, that would be great too. And then I think we'll also continue publishing after the issue goes live in October. So so it's a very flexible deadline, and I wouldn't hold on to something that's timely and interesting now, waiting for specific timing. If it's interesting now, we'll publish it now. How many abstracts can be listed as author or co-author? There's no limit to that. And then we have a question. I'm contemplating submitting an abstract for a case study looking at what one state is doing to tackle a specific issue related to racism in healthcare, co-authored with officials involved. I'm thinking this may fit best as a commentary review piece, but wasn't sure. Any advice or opinion? Rachel, does anything jump out at you from that? I'm going to have to think about that for a minute. I will say we can't always answer specific questions about pieces, but it is. I know it's a hard question knowing exactly what type of piece to submit.
Yeah, I think I think without a little bit more detail, it's hard to answer, because if it's telling the story of like what this one state did, I would see more of a commentary. But if there was some sort of evaluation or like data collection component to the case study, then I certainly see opportunities there for it to be submitted as a sort of research article.
I would agree with that. Yeah, there's no formal case study template within health affairs, but we do have commentaries, we do have analyses and research articles that are broad in definition. So in that case, I think what you call it in the abstract actually probably wouldn't matter too much. Just kind of describe what you did and why it's important.
Right, because if I recall, I think, as abstracts are being reviewed and discussions are being had, right, like that could be part of what's discussed. Like, is this the right fit for, this type of submission. So
right. Absolutely. And there have been cases in the past where something was submitted maybe more as a case study, and we thought this might be an interesting narrative matters. In those cases, I usually follow up with a phone call to sort of find out more information to see if it'd be better fit for narrative matters, for a story, or for a different, or for a forefront. And just as a side note, we do end up usually publishing some of these papers as forefront pieces. So if they didn't, so I lost my video. If they didn't, if they didn't work out for the issue, we have invited certain abstracts to submit to forefront and publish those. The next question, 2 questions. One, is health affairs interested in abstracts that are focused on racism and health outside of the healthcare context, such as the field of transportation or housing? Love to hear from Rachel too, but from speaking from health affairs position, yes, not just healthcare, but health more broadly. So to the extent that racism within transportation or housing affects health, then yes, we are interested in that.
Yeah, 100%. I think that obviously health and well-being and public health is sort of everything, right? And then when you think about the impact of racism, it's so deeply embedded in all the aspects and elements of our society that I think anything could be made, a case could be made for just about any sort of and especially if you think about, the social determinants of health, and where I would see transportation and housing sort of falling into that framework, and the fact that certainly multiple forms of racism are going to dictate access and things like that to transportation. So I think 100% that fits within what we would be looking for.
Yeah, and just making sure it's relevant to policy, especially with the sectors you mentioned, housing and transportation, very policy relevant. So so that's great. And then, so is terminology not an important piece for this special issue? I feel that a terminology varies across stakeholders and disciplines, and there is a lot of confusion around what we mean by different terminology and how they are connected. I'll just say this came up during the planning meeting. It's come up many times. There are different ways of speaking about this. There are sensitivities with the language you use. There was even, a request for could we put out a glossary with the issue? I think that would be maybe challenging on many fronts, because language evolves, terminology evolves. I don't know quite the final word, but I will say, for example, with our recent disability and health issue, and also with the previous version of this, for the previous race and health issue, we do tend to defer to authors. We defer to the terminology that authors prefer to use in most instances, I would say, whether for the disability issue is more like person first versus condition first language. For this issue, it's sort of, some folks prefer the term minoritized communities, some use different terms, and obviously whatever term you use, define it and make that clear what definition you're using. But I would say there's, we're not likely to put out our personal rules on what terminology to use, but making sure they're informed by current dialogues and research, and obviously what's politically correct and acceptable by current standards. Rachel, any thoughts on that?
The only thought I have is, I think this is an excellent question to be asking and pondering for all of us, right? Because I think as a field, we have not fully coalesced around a set of terms and language, which in many instances can be problematic, but also I think it speaks to the fact that we are it's dynamic and it's always changing. So, I think even as a reproductive health equity researcher, I use birthing person all the time, and still have to spend some time educating folks on why that is, and sort of making sure there's a footnote and saying here's why this language is important. So I think being intentional in your language and thoughtful in the terms you're using and the definitions you're using. So I would say racialized communities rather than BIPOC communities. And so being able to say why that is, or if you're using something else, being able to define it and be clear about it. But also, I think we all have, I mean, I would just encourage us generally to do the work of thinking through sort of what each of these words mean for our work and for the field more broadly, and how, and the goals we have for advancing the field.
Thank you. A question, can various aspects of COVID-19 be part of this special issue? Certainly, the topic is one we've published a lot on, and it's continues to be relevant. So it's certainly not off the table, especially as it intersects with racism. I think could be interesting. We'll want to see abstracts for papers we haven't already published, so we'll want to see new directions, because there has been a lot of content published on COVID-19, but certainly haven't covered everything.
And I would just add, like, personally, like, I think when you think about the intersections of COVID and racism, I don't think we've even scratched the surface of understanding the long-term sort of ripple effects and effects or impacts that go beyond sort of the obvious health outcomes piece. And so I think as we think about sort of this broader impact, policy impact and research that can inform sort of how we move forward, articles in that space would be really valuable as it relates to COVID.
Thank you. And there's more questions in the chat, but I see a hand raised. So that's just so novel that I think we'd love to have a real person verbally ask a question too. Is it Moverine?
Oh, wow. Yes. Oh, you got my name right. Most people say Maureen. So Maureen, before I get my question, so my mom was the ultimate negotiator. She had 8 sister-in-laws. She wanted Marva, they wanted Maureen, and she combined it and made it Maureen.
I love it.
Yeah. So the reason I raised my hand, so I'm interested in, and this has been really informative, and thank you for all the information. I've not done an abstract before, but I'm focused on the elderly Black population. And it's from being in charge of the congestive heart failure readmission prevention program. And when you hear the stories of these patients, my parents were a step away from slavery and my grandparents were slaves. And I recognize that the English-speaking population is left out of the cultural competence conversation. And it was humbling. And we have data, we were able to decrease the readmission from 30% to 18.7 in 2 days. In 2 years. And so the question I guess I have is that in abstracts, what I can't not leave out the patient stories in terms of getting people to really focus in on that. And I was the main author, and I co-authored an article for the Journal of National Medical Association and entitled Patient Engagement and Cultural Sensitivity as a Strategy to Improve Health Equities. The solutions are simple as they are complex. So, and developed research tools. So I'm trying to see how do I coordinate the abstract that includes the patient stories and there's a lot of data on health outcomes for the elderly Black population. They have the worst health outcome in all disease. But in terms of the abstract, thank you.
Yeah, I would say I'll put the email in the chat as well, or maybe it won't show up in the chat. We'll send out the email to, it's healthaffairs_racism_queries@projecthope.org. And that's a good way to get into maybe some more specifics and maybe have a phone call or a conversation.
Okay.
Yeah, so because it sounds like there might need to be more of a conversation to find out more. I would say, in the abstract, just decide sort of what the focus is going to be, like recognizing you can't do it all in one paper. Right. So, I could see patient stories being a type of paper, sort of a commentary, but also it sounds like you have data as well. So, I personally just have more questions about sort of where you want to go with all the rich information you have, and sort of how to focus it into an abstract so that we can wrap our minds around it. I don't know if Rachel, you have any reactions. It is hard live to know quite
Right. No, I
quite how to give
understand.
advice, but I would say just you know, focusing in and having conversations. You know, we can't follow up after the abstract is submitted, but
Right.
we can
To
we
move
can
forward.
have conversations now
Okay.
to help sort of shape it.
Great.
Yeah, I don't
Thank
have
you.
anything else to add to that.
Thank you. And then are we looking at only US studies or perspectives or also global? This also came up in both planning meetings for both issues. I'm not sure if we're still deciding internally, but I think we are interested in a global perspective, recognizing we cannot cover the landscape, but we don't want to leave it out entirely. So if folks did submit something from a global perspective, we'll certainly consider it and consider it as we're kind of envisioning what the issue would look like. I think definitely what we receive through the submissions helps us envision the issue. So, you know, based on what we receive, we can see, like, where does this fall? Does this work? Does this tell us the whole story? Are we missing key perspectives? But certainly it's a topic of interest, recognizing that different countries have different experiences of racism and different forms of discrimination, not by race as well. And then will we send copies of the slides? Yes, we'll send copies of the slides after the meeting, and also we'll post them online for folks who did not attend. Do we have research on home healthcare agencies as they play an important role in the health of homebound clients? I want to say we had a home health piece in the first issue on racism and health. I'd have to pull it up to get the specifics, but please do check that out. And certainly it is a topic of interest.
Yeah, well, I think the first author of that piece is Dr. Shekinah Fashaw Walters. I can't remember the title, but
yes, thank you. Okay. Someone did a rapid review for rural Black women preventative programs and measures for cardiovascular disease. However, there is minimal research on this population. What is the minimum articles do you accept for rapid review? I don't think we have a minimum number of articles for rapid review. It's not something we receive a lot of, but we have, you know, we've done various types of reviews, systematic scoping, rapid. I'd be curious, you know, why is it a rapid review versus a systematic review? Sort of why is that methodology being used? Is it not possible to do a different type of review? But that being said, I don't think there's a minimum number of articles that we accept for rapid reviews. Just a compelling abstract where it's clear why the issue is important and why the information provided is interesting. Thank you to Sarah for putting the email address for queries and the link to the website. And then another question, do we accept landscape review as well? I am not totally sure the difference between all the different reviews, but I would say a similar answer, that if it's seems well done, interesting, it's clear why you use that particular method, we'll certainly consider it. And I'm pretty sure I got all the chat questions. So if folks have other chat questions, please add them and we'll see them. And then yes, we can send a link to the article on home healthcare agencies hopefully soon, or you can search the author's last name or look for our February 2022 issue online. It is open access, so you can read every article in that issue for free without a subscription, and you can find it that way. So also folks can raise their hand if they have questions, and let me make sure no one's hand is up before I go to the chat question. Okay. Oh, thanks again to Sarah for posting the link to the article we mentioned on home health. The question, I am new to health affairs. I am an information systems researcher from a college of business. I have several medical researchers and industry collaborators who are looking at health disparities. I'm considering submitting a study that uses an urban academic medical center's EHR data. My concern is that my empirical finding is based on a single site population. Any advice or suggestions to best align with health affairs? That's a good question. We certainly have published papers from a single site, so that alone does not rule it out. It is something, as we're looking at hundreds of abstracts, if there's a study on a similar question, maybe that has, data from multiple sites or national data, that would weigh it in favor perhaps of that piece. If we don't have anything on that really important topic, and it is a single site, then that would, weigh in favor of that piece. So, I mean, sounds like there's nothing, it's not like you're in the position to go out and get more data than you have. So it's just a matter of, is the topic interesting enough, and does it rise above the rest? And is it something that kind of fits with the issue and that we haven't published on before? And I think in that case, even smaller samples or single site studies will be published, and we certainly have done that. Sure. Any other questions?
While we wait for other questions, I just wanted to make another comment, Jess, that is, I don't know how many folks are on this webinar that are not academics, are in the community space, but I just wanted to sort of underscore our sincere and genuine interest in lifting up community voice and sort of pushing the boundaries on sort of how research has been disseminated. I think there's a lot of opportunities, and we thought about this very, carefully and critically last year as well, and making sure that there were opportunities for community voice to be published in the special issue, whether it's as a, sort of typical research paper, but also in the other sort of modalities that have been put forward. So I haven't really heard too many questions in that space, so just wanted to make sure if there's folks who are thinking about that lens, that they get a chance to ask any questions around that.
Thank you so much for circling back to that. That's so important to us, and it's a question we're grappling with. There's so many facets to it. There's maybe not even having heard of health affairs, and that's fine. But we want people to know about us and to know that we are a place accepting such submissions. So to the extent that folks can share out the request for abstracts with community organizations or folks in the community who would be interested, and we're happy to answer questions about who we are, why submit to us, what we're looking for, one-on-one with folks who aren't on this call and really aren't familiar with us. So spreading the word in that way. And we had a lot of discussions recently at the planning meeting about there are alternate types of content. There's stories, there's art, and that is a great way to get community in, but also research articles are cited and become part of the literature and have cachet. And so we also want to make sure that we're, if able, to include community voices in the empirical work as well. So yeah, spreading the word, sending out the RFA link, if you receive it in your email, sending it out to folks who might be interested. And then, yeah, on our end, we'll be thinking about other ways to do outreach to make sure we're reaching more people than we're currently reaching. Because I know another challenge is just time, like with all the work they're doing. And I think somebody said this on the planning meeting, but they're not paid to publish. So is there a way to kind of meet them where they're at? So just something that we're thinking about and hope others are thinking about, and happy to have suggestions as well, and sharing the word.
I would also just at. I mean, to your point, just about, that's not their primary goal or part of their day-to-day job. But if there's folks on here who are even working with community, and you typically don't necessarily do the publication part with them, choosing this as the opportunity to do that and to sort of bring them into that collaboration in this way, I think is, it's, that's not always something that's sort of accessible for every publication, but knowing that, I hope that knowing that like that's something that we are, would love to see would sort of, if you're sort of on the edge there, might push you over to consider that sort of collaboration for these abstracts.
Great. There was a question, the recording, I believe, will be available. Fairly sure, hopefully I'm not wrong. Can you clarify the number of authors that are typically in a health affairs article? Our research teams at times can get big. I think there are some standards out there. I know on our, when people are submitting papers, we ask them to include some sort of statement if there's more than 5 or 6 articles based on the standards that we look at in terms of numbers of authors. And if there are more than 5 or 6 authors, people put a statement of kind of like why everyone was essential to be included as an author. I will say, when it gets into 10, 11, 12 authors, we do sort of ask like, just making sure, are these all meeting the definition of authorship by the standards that we use? But yes, I understand, particularly with cross-sector and community work, teams might get big, and there can be room for flexibility on that, and we might just have some follow-up conversations. I will say that wouldn't factor into, I don't think, our decision during our request for abstract voting. The number of authors you list there, I don't think would particularly sway us one way or another as we're looking at the abstracts. It's more the content of the abstract itself. I'm in that category as a patient, family advocate, and caregiver. What advice could you provide if I wanted to share my experience in this area? Personal stories are one avenue. Commentaries are another. Forefront articles, which are sort of a form of commentary, are another. So it really depends on what's experience you're hoping to highlight and what policy issues it raises and you'd like to discuss. So that could be a question to send to the query email if you want to provide more specifics. I'll go to the hand, and then I should have time for the last 2 questions in the chat. I might not pronounce this name as well. The last name is Choshi.
Yes, that's me. I can really lower my hand. Okay. So I don't know, maybe it's a question or maybe it's a comment, but I just want to speak to the global perspective in terms of the popularity of study abroad in academia and semester abroad that most institutions, academic institutions, are most proud of. They send people out to communities. And also in terms of people mobility, immigration. So about 3.4% of people are not in their country of the origin as we speak. So I think some people come to the United States from different countries. They have experienced some racism of their own. And then coming to the United States as a Black person, you're still experiencing a different type of racism. And the shocking part, especially for people coming, for me, coming from South Africa was that I did not expect that. It's like you think, oh, this country is more advanced. They don't have that kind of racism, but to come here and re-experience that, it's like re-traumatization, was kind of challenging for me because it took me by surprise because I didn't expect it. Which tells me that the patients that are coming from other countries are experiencing the same thing that I'm experiencing. Because if I am a professional, I went to school, I have a degree, I'm experiencing this discrimination in the healthcare and in my work How about the people that does not even speak English? I think that is a disparity that might need to be highlighted in some way. Because at the beginning of this, you talked about trauma-informed care in one of your slides. I think that is really important to highlight for people who are thinking to taking students abroad, because students go to these countries, they say they go there as missionary or going to help. I'm going to help people, or not as going to learn. Not building a reciprocal relationship of exchanging information, but as, they are desperate, I'm going to help. So I think that is something that is needs to be addressed at some point. Thank you for giving me the time.
All right. That's such an interesting point. It definitely strikes me as something, qualitative work could shed some light on, or other types of work, personal story. I think the poem we did last year touched on that a bit, and thank you for raising it. Since we only have 2 more minutes, I will go to the last 2 questions. So we have a paper documenting evidence of structural racism in provider practice location that has policy implications, but does not specifically test a particular solution. Would that be of interest? I would say yes. We, in the previous issue and throughout our time publishing about racism, but also health equity, there, certainly sometimes we are, defining the problem. And while there's an interest in going further and also defining solutions and discussing solutions, that doesn't, I'm sure there won't be a solution in every abstract we receive.
Right. And in some cases, we're just not at the solution phase yet, right? So, yeah, I think that paper sounds super interesting.
Yeah. And then lastly, do community members need to pay the open access fee, or is this waive discounted in the spirit of equity? I can let you know, again, I'm pretty sure that this issue is also going to be open access, thanks to the support of our funders. In general, we don't charge in health affairs proper, we don't charge. We have, open access issues supported by funders sometimes, and then we also have other content that is behind the paywall and do need to subscribe, and it is possible for individuals to pay a fee for other articles, but this particular issue should be all open access on the part of the funder, so not having to pay a fee as an author. Well, that is perfect timing. I think, got to all the questions. Thanks so much again, Rachel, for joining us and for your insights. And thanks so much for everyone for your attention and your questions. And we really hope to see a lot of exciting submissions. I think you said it, thinking creatively. If you have the time, submit it. If it seems interesting to you, submit it and we'll find out if it fits within the issue. And of course, we're interested in publishing on this, not only in the issue, but going forward in general between issues. So if it doesn't all fit perfectly in this one issue, there's opportunities to publish in health affairs otherwise. Well, thanks everyone. Have a good rest of your day.
Thank you.
Thank you.